So we can do hip and knee replacements using three methods. We have the conventional manual surgery, then we have navigated surgery, and then we have robotic surgery. This is the era of robotics, and we at Amrita Hospital use the best technology in robotics, which is Mako. And it can do all kinds of hip and knee replacement surgeries. In fact, it is the only machine in the market which can carry out all these surgeries. No other machine can do this. And there are lots of benefits if you talk about it. So from the surgeon's point of view, the benefits include, because we do a CT scan before surgery and we plan the surgery on the CT scan, it gives us more confidence while executing the surgery, and we know exactly what we're doing during surgery. The size of the implants are selected before surgery in a very accurate way because the planning is on CT obviously. And anything I want to change during surgery can be done very easily. So from my point of view, the surgery becomes extremely accurate and extremely reproducible. From patient's point of view, there are lots of benefits as well. So you have reduced pain after surgery, which leads to faster recovery, and you can return back to your normal activities in a much faster way compared to manual surgery. It also reduces complications, like you'll have a reduced risk of hip dislocation after surgery. You'll have a reduced risk of knee being stiff or loose after surgery, and you'll have better strength in your knee. And the rehab is just faster, compared to a manual surgery. So in that sense, the overall result and the overall feel of the surgery after, in the early post-op period and also in the late post-op period is much better compared to a manual surgery. The other point is that we take out much less bone in robotics compared to manual surgery. And this leads to the implant lasting longer in robotic surgery. Apart from that, there are safety points as well. So a robotic surgery is safer for the patient in terms of cardiac and neurological side effects. And it is also safer in terms of the reduced risk of blood clots after surgery. Thank you.